I'll be moderating tonight's discussion. If you will forgive me, I am going to take a seat here, okay? Because I got some mobility issues, and you don't want to see me falling down in front of you. Or maybe you do. I don't know. Do we have a pool going? How long will Hurley last tonight? All right. Water, Paul. Tulare County Voices at 210 is a monthly forum here at 210 that's devoted to a discussion of a topic of interest to the community in an open forum. All viewpoints are welcome here, and all expressions are welcome here, as long as they're reasonable and polite, and in keeping with any other public body. You're encouraged to participate in our discussion tonight by raising your hand that you would like to ask a question, and we'll get to you as soon as we can, okay? Tulare County Voices at 210 is co-sponsored by Visalia Times Delta. I think Valley Voice really deserves as much credit for some co-sponsorship to this body as the Times Delta does, and of course by First Presbyterian Church, which owns this building and this space. We are eternally grateful to First Presbyterian Church for allowing us to use this space free of charge every month and encouraging us in our mission of providing a place for open forums monthly. So let's hear it for First Presbyterian Church. That's great. Now I know that you can applaud, so you're positive, and things are going to go just fine. Tonight's discussion will be on animal services in our community. When we started out and we were thinking of doing this topic, we were calling it animal control. I don't know. I think maybe is that an old guy? Is that an OG thing? Is that an old guy thing? One of those terms that is kind of like gone past us, because I believe that the agencies that are represented here tonight would refer to it and would prefer that it be called animal services. Because there's in the first place, there's a lot more to the topic than just making sure that nuisance animals aren't on our streets, and that we can keep track of who has what pets in our communities. Animal services includes a lot more than that, including the general health of our pet population and the services to pet owners. Tonight we have, helping us with this discussion, for very knowledgeable and qualified people to talk about the role of their agencies in this mission of animal services. Might as well go left to right and introduce them. First of all, there's a little placard up here in front of each of them, and I hope that most of you can't read it, because the first one is incorrect. This is not Lisa Kukala of the Feral Cat Coalition. And I'm also told that the proper name of the agency is the Visalia Feral Cat Coalition, so that's also wrong. So you know, we're kind of batting zero so far tonight, but we're gonna improve that. Mark Egg is representing the Visalia Feral Cat Coalition tonight. Yep. Eggy. Yep. E-G-G-E.
Correct.
Palindrome.
Yes.
Very good. Okay. Next, going left to right, is, well, our top official in the city of Visalia, City Manager Leslie Cavilla, who is in charge of all services for the city of Visalia. And we are delighted and honored that she would take the time to help us with this discussion tonight. And I'm sure that she's going to do as well as anybody else in her agency. But, you know, it's not her official title, so, you know, give her a break. Next, BJ Modko is representing the Central Valley Rescue Railroad. Kind of a adventurous, very exciting title. And she's going to tell us more about what their agency does. Thank you for being here this evening. And finally, representing Tulare County Animal Services. Did I get the title of that agency correct?
Yes.
Okay, there, I got one right anyway. Cassie Heffington, who made a very, very nice presentation to the Board of Supervisors a couple of months ago. And that helped us in our discussions and in putting together these questions and deciding what kind of things we want to talk about tonight. Cassie, do you mind if we start with you?
Sure.
And if you could just let us know what your agency does.
Absolutely.
Basically, it comes down to that, doesn't it?
Right. So I think that a lot of the confusion in all of our county cities is how is animal control or animal services? See, I've been in this field for the last 15 years, so I'm stuck on animal control sometimes too. How is it organized? So we at Tulare County Animal Services do have jurisdiction over all of the unincorporated areas of Tulare County. So that's all of the places that are not an incorporated city. Oh, do I need to hold it further? Thank you. Hand signals. Awesome. So all of the unincorporated areas of Tulare County is who we serve. All of the cities generally have their own services, and I think the easiest way to remember it is that the city of Porterville has their own animal control and their own shelter. The city of Tulare has their own animal control and their own animal shelter. And then all of the other incorporated cities basically contract with the city of Visalia. Is that mostly true? Three. So the city of Dinuba, the city of Exeter, and the city of Farmersville contract with the city of Visalia, not all of them for sheltering services, or not all of them for field services, but for sheltering services. So we have all of the areas that are in county jurisdiction. So like Ivanhoe, Cutler, Orosi, down south, Early Mart, Pixley, all of those are our jurisdiction, and then the rest fall under the city's jurisdiction. So we at Tulare County Animal Services have 3 different departments within our division. We have field services, which are the officers that go out and respond to calls from the public. We respond to approximately 6,000 to 7,000 calls per year with 4 officers over about 4,800 square miles of county. The longest we have to drive to one call is about 4 hours one way to Kennedy Meadows, and we do have calls there sometimes. So we go all the way up into the mountains and all the way down south, all the way to Kings County line, Fresno County line. And then we have the shelter operations team, which are the people who care for the animals once they get to the shelter. They also house our adoption, rescue program, foster program. That's all housed with shelter operations. And then in 2021, we added clinic operations. So we added a small spay and neuter clinic to our shelter, which serves the public and it serves our shelter animals, spay and neuter. They've done, or our clinic has done a little over 10,000 surgeries since 2021, spay and neuter surgeries at the clinic. And we have a position for a full-time veterinarian that is currently vacant. If you know anyone looking, please send them my way. And then we have 2 veterinary technicians, 1 registered veterinary technician and 1 unlicensed veterinary technician who triage and treat all of the animals at the shelter based on the direction of our contracted vet. So we have a contracted vet that we do telemedicine with, and then we have relief vets that come in 3 to 4 days a week and do spay and neuter at our facility. Does that cover? Anybody have any questions on that?
A few numbers.
Oh, sure. So we intake about 6,500 animals per year. We have 50 kennels, 10 of which are quarantine kennels, and then we have 12 basically temporary kennels that are like temporary panels. We have a puppy room with 4 very small little kennels and a couple of kennel banks. So we take in 6,500 animals a year with about 65 kennels. So it's always very busy. We take in anywhere between 20 and 65 animals per day, most of which are dogs and sick and injured cats. We take in stray dogs, which not all shelters do right now, and we take in cats that are sick, injured, too young to care for themselves and don't have a mother, or have a need to be at the shelter, like their owner died, or they were abandoned in an eviction or something like that.
Do you have an estimate of how many pets you spay or neuter Or don't you do that service?
About 3,000 a year.
About 3,000.
Right.
You
We're
mentioned
actually
that.
a
I'm
little
sorry, I
over
missed it.
3,000 right now for 2025. So we'll probably be approaching 4,000, 4,200 by the end of the year. Some of those are our adopted pets. We do a lot of public cat spay and neuter, which I don't think a lot of people know about. We release online appointments at the beginning of the month and usually around the 15th of the month for the 2 weeks following, and you can schedule online or people can call or email us. Our dog appointments are slightly more difficult to come by because a lot of them are taken up by our adoptions. We want to make sure that everything that we adopt out is spayed and neutered, but we do have them available. We also use those dog spots to do case management out in the field. We are getting calls constantly for people who have 20, 40, 50, 60 dogs or even more cats, and they are on every street corner. So we use that a lot for case management and assisting people with spay and neuter through the field services.
60 stray dogs?
Not stray, it's people who own dogs. We have an issue not necessarily with breeders that are breeding on purpose, but people who are just don't know what to do. There's a severe veterinary shortage of veterinary professionals, and people cannot get access to basic care here in Tulare County, which is something that some groups are working on. I know Visalia Feral Cat Coalition does a ton, and there are several other organizations that are working. We are very close partners with San Francisco SPCA, who is doing a pilot project actually in the city of Early Mart right now. So they are bringing a lot of spay and neuter into the city of Early Mart to prove that massive spay and neuter is going to work.
Really?
Yes. So
That's
working
a
on that.
Good story right there. I didn't know that.
Yeah, San Francisco SPCA has been a wonderful partner. They are the reason that we have the relief veterinarians that we do. They actually pay for a lot of it through a grant through Cal for All Animals, which is the money that the governor gave to UC Davis Correct Shelter Medicine Program to disseminate throughout animal services organizations and nonprofits. San Francisco SPCA. It's a long-standing partnership that was actually started by BJ, so she can tell that story. That's her story. And she connected their CEO, Dr. Jennifer Scarlett, to us, to me, and it's been now a long-standing partnership for about the last 9 years. I was at Kings County when we started, so I was the shelter manager for Kings County Sheriff's Department for 4 years, and then I've been here at Tulare County for the last 6. Prior to that, I was in high volume spay and neuter. I was an administrator at Hope Animal Foundation in Fresno. So I've been around for about the last decade and a half.
You got a resume there. Is animal services under Kings County jurisdiction, Sheriff's Department jurisdiction in Kings?
In Kings County, yes.
Yeah,
Here it's under
okay.
Health and Human Services.
Yeah. Well, I don't. I think it's probably better there.
Agreed.
How does that number of animals, how does it get to those kinds of numbers? 60?
I think
Yeah.
just a lack of access to care. And so during COVID, what happened during COVID is that 1, everybody got an animal, and 2, nobody got them spayed and neutered because spay and neuter was not considered an essential service during the shutdown. So they estimate, some of the big box agencies estimate that 3.2 million spay and neuter surgeries did not happen during COVID, which means that 3.2 million animals were potentially out there that could have been spayed and neutered that were not, and that has caused a major influx of animals. So we have people that are, I used to say, when people would be like, oh, they were dumped out on my property about dogs, I used to say, well, sometimes that really isn't true. They probably belong in the area. Now I say, absolutely. It's happening on a daily basis. We are getting calls for not 1 or 2 animals on a ranch somewhere, but like a dozen or more than that. So animals are being dumped out in our county orchards constantly.
There's an angle I hadn't considered, but I think eventually we're going to be able to blame everything on COVID. Questions? Somebody had questions behind me.
I could talk
Okay,
forever,
I'm
so we're
getting-
going to
I'm
need like a
getting-
hand signal or something.
I'm getting torn here. Some of the committee members are saying, hey, you got a question here, so you got to answer it now. And others are saying, well, wait till everybody's had a chance to talk. Can you hold your question until everybody's had a chance to talk? Then, very good. We have some unity here, almost. BJ, sorry, we're going to skip you for the time being because I'd like Leslie to explain the same kind of thing that fills in some things about how you in Tulare County, I'm sorry, not you, but City of Visalia and Tulare County Animal Services work together, how you're different, et cetera.
So much of what Cassie said is similar to what the city of Visalia does as well. As far as we take in about 3,600 animals a year. We have two divisions. We have the, we call it animal control, which is actually the officers that go out with the trucks and so on. 3 of them are centered here in Visalia, and 1 of them is shared between Exeter and Farmersville. We contract with them for that. And with the city of Dinuba, they have their own animal control officer, and they bring, and we just shelter for the city of Dinuba. And it's simply a matter of economics in many cases for those smaller cities, because they just can't afford to have their own shelter and care for them. So we are trying to work cooperatively with them in that regard. And then we have our animal care facility, which is then operated by the folks that clean and feed and work on the adoption, work with the rescues, and try and get as many animals back out into the public as we can responsibly. We try and do different types of education. We really are trying to grow our foster program right now. Something else that we did recently was we added 3 public chip reading stations. One's at the Anthony Center by Recreation Park. One is at Station 54, and one is at, I believe it's Station 53, one on the south and one in the north facility. So then when someone finds an animal, especially if it's weekends or evenings or something, they can try and locate it with a chip if at all possible. Because what we want to do is see those animals returned to their owner if at all possible, and that is also our focus as our animal control officers are out in the public, to first try and find the owner and just see, you know, does the neighbor recognize it? Just what can we do to get the animal back in with their owner?
Anything you do different from the county?
So we do not have our own vet. We do contract with a part-time vet, I should say. We have not had a permanent full-time vet. We are very grateful because Tulare County is willing to share their access to the spay and neuter. So we have a couple of days a month in the last couple of months when we've been able to have more animals spayed and neutered, and that's been a tremendous help, and we are very grateful for that cooperation. And I know there's a lot of information exchange and so on between the 2 organizations. But
that's good.
And if they can find a full-time vet, we'd love to buy some of that time. But,
yeah, I'll bet. We're going to try to stay away from a lot of the sort of political and jurisdictional issues that arise among animal services, because, you know, as I said before, it doesn't serve anybody, but we know they're there. But I think it's very encouraging to hear that your agencies can cooperate so well. So that's a good thing for pet owners and especially for animals. BJ, now that you've been neglected and I have rejected you,
Yeah,
can you ever
exactly.
forgive me?
Maybe.
Oh, okay.
We'll see how it goes.
It's better than what I thought I was going to get. What does your agency do?
Okay. Well, we're the Central Valley Rescue Railroad. I founded this organization about 15 years ago after 10 or so years of volunteering at what used to be Valley Oak SPCA Animal Services. And we just kind of grew from there. I would say that our role in the community is basically to work alongside the shelters to try to ease the crowding and the overpopulation, to connect with the community, try to get some education going out there. We don't have an actual facility. We have my property, which now has a pretty large campus. We take in anywhere from 500 to 1,000 dogs and a couple of cats a year. That number is a little bit lower right now just because we don't have the ability to provide good outcomes right now. Adoptions in general, I think anybody that's in rescue will say that adoptions have slowed down significantly. That is, it's a social issue and an economic issue, and it's a demographic issue. So there are a lot of pieces to that. We have puppy transport programs. We try to provide some spay and neuter assistance when we can, but we have no ins with vets either. So trying to get animals in to have these services, we don't have any magic wand to make that happen as well. So we're just out here trying to educate more than anything and help as many animals as we can.
At any one time, how many animals do you have at the station, so to speak, waiting for a train?
At the depot?
Yeah, at the depot. Yeah.
Yeah, we call that the depot.
Okay.
An average number is probably 45 to 60.
Oh, that's tough.
That's a big
lot
number.
That's a lot of animals.
We
to
have a few
care for,
foster
too.
homes, but as all the agencies know, building a foster program is complicated and high maintenance, and so we're working on that, but it's different.
How do you deal with spaying and neutering the animals that come to the depot?
We have 2 veterinarians that we work with. We have a certain number of appointments available to us, not at discounted prices. We don't get deals either, but we do have access. On an average week, we can do, if both vets are available, we can do 4 surgeries from one and 5 or 6 from another. So that's not a very big number.
Wow.
And we also try to provide some vouchers to veterinarians. If somebody brings us a litter of puppies, our conversation with them is how do we stop this from happening the next time, and try to provide some services for that as well.
How many animals can you find homes for, or send them down the tracks, so to speak?
Well, I mean, the answer ultimately is all of them. It's just the time frame. Again, we used to be able to place between 500 and 1,000 animals a year between transport programs and adoption programs. I would say we're probably half of that right now.
Yeah. Okay. Are things generally kind of going that way for all your agencies? Yeah? Okay. I'd like to hear your story that Cassie started for you.
Yeah.
You can blame her.
I've over the past 2 decades, I've attended a lot of conferences around the country, really tried to educate myself on humane education and what to do in my community. And about 10 years ago, I was attending one in Southern California, and they had little great breakout groups. So I was sitting at a table with Dr. Scarlett, and we struck up a conversation. We really hit it off, and she was saying that even though that she's in the Bay Area, she had a great love for the Central Valley. And I said, well, hey, I can help you with that. So as soon as the conference was over, I contacted her, because I'm pretty persistent, and we made connections, and they started helping us, and I got her in touch with Cassie, and that's just been a wonderful, wonderful partnership, because not only do they bring a lot of education and hands, they bring a lot of money into the area to try to support some of these programs.
Oh, that's good. Very good.
And I guess I should add that our agency is completely, we are a nonprofit. We have no grants, we have no funding. We operate on adoption fees, which don't even cover expenses, and private donation.
How many volunteers do you have then?
45.
45?
I have my volunteer coordinator here.
Oh, that's good.
Absolutely.
Did BJ get anything wrong, by the way, so far? No? Okay.
Not yet.
45 is a pretty good number of volunteers for
Yes, it
anything
is.
these days.
Yes.
That's a good sign for you. Mark, just about to call you Lisa. You're practically twins. Could you talk a little bit about the Visalia Feral Cat Coalition?
Sure thing. So my name is Mark Egge. I am with the Visalia Feral Cat Coalition out of Tulare County, and what we do, we are a nonprofit group that works with the public. We believe trap, neuter, return management is essential to bring down the population of feral cats. So we work with the public to line those working in their neighborhoods with colonies around them throughout Tulare County to low-cost spay-neuter options through our vouchers and through our mass TNR clinics. What we like to do when we can afford to do so is host an 80-cat mass TNR clinic with the vet that will partner with us, and we'll have the public bring in 80 cats to be spayed, neutered, vaccinated. They'll get a long-lasting pain medication, flea meds, and then they will return back to their colonies to live out the rest of their life without having to procreate anymore. We believe this breaks the reproductive cycle.
Mm-hmm.
We love the fact that it reduces disease throughout the area, and we prefer to euthanizing animals in a heartbeat. We deal with a lot of people who overwhelm the shelters everywhere, and as we all talked about, the vets are all overwhelmed. So we don't believe that all cats belong in shelters. Some cats belong feral, but doesn't mean they can't be spayed and neutered.
So they don't make any more
Correct.
of them. Have you had one of these sessions, 80 cats?
Oh yeah. We were hosting them monthly for the longest time. The next one we don't have a date yet. It's all a matter of being able to afford it for us currently. So right now we are leaning on our voucher program, which offers a $30 voucher to the public, again as we can afford it, to take the feral cats to a vet that is partnered with us to be able to go on their own time. Both are good. The 80 cat clinics kind of puts it all in one day. The vouchers, it opens it up to a little more realistic schedule.
How many veterinarians do you need to have a clinic like that?
Well, one typically, and anyone willing to work with them, and then usually they're vet techs that are willing to volunteer their time, and then we always show up for intake and outtake.
What's the cost?
Yeah.
It's $30 per cat. Oh, for us on the back end. So whatever a vet charges, public pays $30 of that, and we pay the back end. So it varies by vet.
Round number.
What?
Between. Yeah, it's about $100 a cat.
Yeah. What's your experience, the rest of you, about cost for spay and neutering? Either by your agencies or with others you contract with or whatever.
So what does it cost to get an animal spayed
Yeah.
or neutered at our facility?
Yeah, both. What it costs the public and what it costs you. Same way they did with this.
So the way the county does the fee schedule is it's on a cost basis. So how we determine the fee is to cover our costs. So they're pretty much the same. Although we do, sorry, Supervisor Strickland, lose money on spaying and neutering cats. Our cost to the public depends on the gender of the animal and the size of the animal. So cats are anywhere between $35 and $55, and dogs are between $65 and $150. So a large female dog would be at that top end, and we're talking major costs lower than a primary care veterinarian, which would cost about $600 versus our $150 to get a large dog spayed.
Really? Wow.
There are some extra charges. So if you want vaccines added to that, we can add vaccines. We can add microchips. There is a slight charge if the dog is pregnant, but other than that, most things are included. That includes post-op pain medication and an e-collar if the doctor feels it's necessary. And also, if the dog is large and really active, the doctor will also elect to send home sometimes some mild sedative, and we don't charge extra for that generally.
Is the resident of the pet owner an issue? Do you only do animals that are owned by Tulare County residents, I guess what I'm getting at.
No, some of our grant funding is specific to areas or types of animals. So we have some grant funding that's specific to people who are low income, although they leave that up to us to determine what that is. And some of our grant funding is specific to feral cats or community cats. But otherwise, if you're in the city of Visalia, city of Porterville,
Yeah.
if you sign up for an appointment, we will do your animal. But we have people drive from the city of Fresno sometimes, but we try to concentrate the majority of our efforts locally.
Okay. It's easier to get services here than it is in Fresno?
Oh no. I
No.
think Fresno has Hope Animal Foundation, which does a lot more surgeries than we do. They have 3 doctors. They
Okay.
probably average about 180 surgeries a day at this point, 4 days a week.
Wow.
That was the last number I heard.
Okay. Well, that's not here.
I believe they just did a TNR. They did 100 TNR yesterday.
Yeah, I believe it. We share some veterinarians, so the veterinary community is
Yeah.
so small at this point that everybody kind of works everywhere.
And
so
they all know each other, et cetera, yeah. And they know what the need is. Leslie, anything to add to that about cost of spay neuter for City of Visalia?
So we don't have a vet that performs
does
that
that.
other than for our shelter animals. So we don't offer public ones. If someone's going to adopt an animal from Visalia, then it's $155 for a male animal, $165 for a female, and that includes the spay and neuter, the microchip, and any vaccinations needed.
Okay.
The city does offer spay and neuter for feral cats.
Sometimes we can get some appointments for that to occur. That doesn't occur at our facility.
No, but
Oh, I
the
see.
intake is at your facility.
It can be. It depends on each situation. Sometimes we are taking. Usually, people take the cats directly to the facility, not to our facility.
Okay,
You
that's
mean-
not my experience.
So they
Well,
just
I-
recently had one where they even posted it on the animal services, you come and line up, there's like 10 to 12 spots and
Wanna
it's first
start
come, first
giving
served.
people
They
questions?
take them and get spayed,
And then bring it back. It can vary. So and that's why I will say it can vary, but that's not always the way it is. I just hate to throw that out there that you can bring them to us and we can automatically get them done. There are times when that is a possibility.
Yeah, okay. It strikes me that, we do have another agency who's not with us tonight, and we could really use that information about what the costs are and the procedures for Valley Oak SPCA. But unfortunately, we struck out in getting them to join us this evening.
I think
Derek?
their prices are listed on their website.
Yeah, that's true. Yeah. There's a lot of information listed on all your websites, by the way. They're very good. They're very good. So, City of Visalia's Animal Services thing, just about answers every question. And Tulare County's got all kinds of posters there with different things. And BJ, the Rescue Railroad's got amazing amount of information just in a small space. We have a question. Go ahead.
Yes, I have a question for Ms. Cabilia.
I
Okay.
go by Leslie.
Leslie? You have a city ordinance, 6.08.030, public nuisance. It is declared a public nuisance for any animal except cats that are spayed or neutered or currently licensed by the city of Visalia to run at large or to be on property other than that of the owner of the animal without the property owner's consent. So the way I'm reading this is animals at large are a public nuisance. Why is the city not addressing that?
So I'm not going to tell you I'm an expert on every one of the ordinances with the city of Visalia, but cats are considered free spirits, and so that probably is a change that needs to happen with our ordinance.
Well-
I'm going to look a little bit to Cassie if she can chime in there. So I know there are the feral cats and so on that are out there. With regards to dogs, we do pick up a number of dogs every day.
Okay, but so you want to change the ordinance so that you don't address the problem. You continue to not address the
We're
problem.
not allowed to, because cats are considered free spirits
What-
by, I believe it's state law.
Yeah, that sounds like
State law.
State law says
That-
what?
It's that cats are free spirits.
Well, I understand that, but
Yeah.
what is it?
That ordinance sounds like boilerplate from the state.
It sounds like something we need to update, and I
Yeah.
will gladly say
Yeah.
yes. But we'll find that throughout our code ordinances, and once that needs to be addressed.
Okay.
Okay.
Were you asking about cats or dogs? Oh, okay, okay. Okay, another question right here.
I basically want to say something to balance out this. I have been doing TNR and co-founded a program in the Bay Area back in '89, so I've been doing this for a long time. But the homeless cat population is a revolving door. You rescue a cat from the street, and your neighbor down the street loses or abandons another. Cats are domestic animals, not wildlife. and lost or abandoned, they revert to unsocialized or feral behavior for survival. Too often, they have not been spayed or neutered, and they reproduce unwanted litters who often suffer brief lives in our hazardous world. Homeless cats and their offspring are victims of human irresponsibility and neglect. We are the problem.
Okay. Was there a question in there, ma'am? Because I think
Did you have a question?
I did have a question earlier, a numbers question. What is your euthanasia rate?
Can you put the mic?
What is your euthanasia rate, and what is your rationale for doing that?
Are you asking me or are you
I'm
asking?
asking.
ma'am,
I'm asking
could you hold that
generally.
question for just a bit? Because we're going to get to that topic with the entire panel in just a second, okay? Okay. All right. Other questions? Have we?
Yes, over here.
I don't see the name up there, and maybe I'm just not reading it right. Visalia Animal Services out off of, 99, has the contract for the city of Exeter. But we are informed that we are only to call them if an animal is sick, dead, or dying. If there's an animal on the loose, they don't want to deal with us. At least that's my understanding. So my question is, when Visalia Animal Services, and the rep may not be there, when they offer these, okay, good. When they offer these feral cat TNR clinics, it says Visalia residents only. And so people from Exeter, we're not welcome to participate in those programs. What can we do to try to get to become, to be able to bring our animals for those programs? Do we need to talk to our city council? I've done that. They don't seem to be willing to help. Maybe my approach is wrong. I mean, we're just looking for ways to help control our animal population. I personally have fixed 13 cats. I have
Thank you for
I
doing
have
that.
fostered 9, and I have adopted 6. I'm on a fixed income, so I pretty much can't do much more than that. And there's a lot of people, though, who are willing to help if they know their resources.
Well, that's one of the reasons we're here tonight. But Leslie?
So we do contract with the city of Exeter and the city of Farmersville, and there is an animal control officer that is specifically assigned to those two cities. So they do go in between, and we try and provide backup when we can if needed. Because it's it's a severe situation. There was a time a few months ago when we were short-staffed, and I would say that Exeter and Farmersville suffered some during that time because we didn't have all the animal control officers we needed. In fact, we didn't charge for some of those times because we knew we weren't providing all the service that you needed. We should be back. We've got all 4 animal control officers now, so it should be that they are picking up strays or working to get them back with their owners or bringing them into the shelter. So it shouldn't be a matter of just if an animal is sick or dead or dying or injured. So I apologize for that, but I do believe we're in a better place. When we do spay and neuter programs with the city of Visalia, those are funded by our city. So we do limit them to only our residents. And so if you wanted to expand your contract to include that, first of all, we'd have to find more spots for them. We don't even have enough for our own city, but that is something that you could contact your council about adding to the contract as space is available.
We do have another question over there.
Yeah, I mean, I'm louder than your microphone.
Well, yes, you do, because people over there can't hear you.
I can scream.
Yeah, they can.
So what is, or I don't know if you know this, Leslie, what is the estimated cost for like a spay and neuter clinic if the city of Exeter, like if we, because I live in Exeter, I own Underdog Adventures, so we try to rescue there as many as we can and try to keep them out of the shelter, especially the high risk like pit bulls and those animals. If we wanted to approach the city and say, hey, we would like to see this for our community, what would be the estimated cost? Like if we were to band together, raise funds and all that?
I don't actually have a cost for you. The issue is availability.
Got it. Okay.
Right. It's just there is such a severe shortage. I think there's an answer to that
Yeah.
that has been pretty much ignored in the state as far as I'm concerned. And that is that I think much like they do with humans, there's what they call first assists who assist or now physician's assistants that do a lot of very complex medical
Yeah.
procedures. We've advocated for over 10 years at the state legislature to have vet techs be able to be higher trained so that
Yeah.
they could perform spay and neuters and they could help resolve this problem. And it becomes a battle at the state. I do know, and I know we're not getting political here, so I'm not going to go into detail, but I have been told by one of the legislators that they are going to reintroduce it next year, and there is a conservative and a liberal who are partnering with it to try and push it through because it is what makes sense and it's what we need to better provide for the
It
animals.
would be great if we could all go for like a legislative action day.
Sorry.
Maybe the city or the county
Wait,
can plan
stop.
like a legislate.
Rewind.
Okay.
We didn't get what you were saying. You,
Oh,
we had
I was
some
just-
applause here, and it was drowned out. So what were you trying to say?
I was just saying if that is the case in the future, maybe if the city or the county can organize a legislative action day and we can, community members can go up there. I know that's been very effective. I'm going to throw you out there. We've gone up there for adult education advocacy, so I know we're happy to support if you guys need help.
Sorry, I was just going to say one idea. Is it possible that the Feral Cat Coalition, you can get more spots? If the city can't help, there might be another way. by working with
we
the,
work with Corinne.
Yeah,
She's
okay,
awesome.
Okay. I mean, because then perhaps they could be guaranteed certain number of spots, people living outside of the city, like in Exeter.
Guarantee is a hard one right now, but we definitely work with everyone we can. Yeah.
Paul, is this a good time to bring up the subject of the dearth of veterinarians in general, which seems to be a common thread here?
Sure. Who wants to take that on the panel?
Everybody's
Cassie?
going to look at me.
Yeah, probably you.
So there are the same number of veterinary schools now as there was in 1955, but we have so many more animals in this country. Everyone everywhere is facing a veterinary shortage. I know Leslie brought up a really good point. There have been pieces of legislation that have been brought the last, I think, 2 years that have advocated for registered veterinary technicians to be trained to perform at least cat neuters or neuters in general, because a cat neuter takes about 3 minutes to perform. And they can induce anesthesia, but they can't do the actual surgery. And I think the sticking point there is the Veterinary Medical Board. So I'm not entirely sure what their reasoning is, but that is the part where it is. Yeah, I think you hit the nail on the head right there.
The state of Colorado just passed it by an initiative. I'm not proposing that, folks. That would be very hard, but that's how far they had to go to get theirs through.
And Supervisor Sheckley and I have gone to legislative advocacy days. San Francisco SPCA actually funds an animal advocacy day, so next time I'll let you know when it is. So I've been to Sacramento a few times, and we go and meet with legislators individually as groups of animal advocates and actually speak about what we are experiencing in the real world. So I think that's been very helpful.
Go ahead.
Well, this is kind of a backtrack, but Cassie, we've talked about cats and dogs a lot. Can you kind of give some examples of what other animals the county is tasked with? And can you kind of give what happened with our clinic, how it came to be?
Cassie,
What
this
do you
is your
mean?
opportunity to just tell Supervisor Sheckley no.
No, I would never do
You do it
that.
here. You can
I
do
would never do that. Honestly, Supervisor Sheckley and the Board of Supervisors of the County of Tulare is the main reason why I have stuck around as long as I have. I have never worked for a more supportive agency and administration, and they are fantastic. Can I talk about the really good thing?
I think everybody here knows.
Am I allowed to
by
talk about the
way,
really good thing?
The,
Yeah.
uh-huh.
She's not going to tell on me.
Before we get too far, that was Amy Shucklin, Supervisor, Tulare County Supervisor, Representative Visalia, and I think everybody here knows her devotion to animal welfare in our community. So thank you for being here tonight, Amy. Appreciate it. Proceed.
So the other animals that we take in livestock. So we take in stray horses, cattle, goats, pigs, too many pigs. We've had an emu before. We've had. We made you keep it on your property, or we offered? When was that? We could
come out with a horse trailer. But
please
they
come
never
in
did.
and talk to me about it later because we,
No, I
if
just
that's
thought
a
it was
problem,
an
then we
interest-
definitely need to work on
It was
that.
an interesting story, and it got solved. I found a place for it.
We have had emus in the past. We have, during both of the major fires that we've had in the last 5 years, we have housed up to 250 livestock in various areas. We have a horse right now. We house a lot of roosters in the spring. Yeah, we house a lot of roosters in the spring. But the really good thing that I asked if Supervisor Shuckley if I could share is that the Board of Supervisors has dedicated some funding to the county to be able to expand our shelter and add 48 more kennels, which almost doubles our capacity, which is fabulous. I'm sorry.
Oh.
Proposed. Leslie said I could say proposed. You said you wouldn't tell on me. Which will help address this lovely human's problem of the euthanasia rate. Pardon? Oh, the increased salary band for the veterinarian to hopefully attract someone here. Unfortunately, a lot of the new grads want to go to the big and sparkly places like LA and San Francisco, and nobody wants to come here and hang out with me in our tiny shelter.
And I think that's an important point, though, because, vet school is what, 4 years of college and then 4 years of vet school and a lot of expense for it. And you don't get out, most people, very few are going to get out and say, yeah, I want to go be a vet in a shelter, and that's why I went to 8 years of college. I mean, I think we have to deal with that reality and maybe look at part-time, look at maybe retired vets, ask them, will you come one? Because we'd love to partner in, but I think we're gonna have to think even more creatively.
Right.
Did we have any veterinarians join us tonight? Anybody in the audience a vet? Is there a vet in the house?
Nobody wants me
No?
talking to them
Okay.
afterwards.
My question might be more for the end, but I was wanting to know how successful the trap and release has been in decreasing the feral cats. And our,
Can't hear.
sorry.
How successful has TNR been for reducing the feral cat population?
Of course. Yeah, return is super important to us because we believe in management. And what that means is to trap, neuter, spay a feral cat, it needs to go back to where it came from. We want to avoid dumping cats out in the country, which was a previously stated issue. And the reason behind that is we believe in the vacuum effect. If there is an environment that a cat can establish and create a home in, if it's removed, another cat will take its space. So the idea is to have a managed colony that is all fixed. Cats are territorial by nature. They will maintain that space. They will hold it. As for a number, I don't have an exact number. We've done over 1,200 cats this year to date through our group, but we're not the only TNR group local to Tulare County.
The question was, though, is it effective? Does it help reduce the population?
From my own experience, yes. Yeah, I don't have kittens. I haven't had kittens in my neighborhood and the field behind me in 2 years now, and that's I've been doing this 5 years.
Does that help, ma'am?
Okay. I'm going to just throw in the other side of this is there's got to be more advocacy and education for spay and neuter so that it gets done before it ever gets to the point of these animals being roaming free.
Okay. Yeah.
And that falls back on us.
Okay. For those who couldn't hear, the lady saying we need more advocacy and education about programs for.
But we need
for
more
animals.
spots, because we get lots of calls. We just don't have anywhere to take them or to send
Okay.
them.
Yeah.
Which, a couple of points here. According to the University of California, for population reduction to successfully occur as a result of TNR, more than 75% of the population must be sterilized annually with no new additions to the colony. Currently, this is for California, the maximum spay-neuter rate achieved at county level is approximately 2 to 5%. So I hate to say it, but you're kind of spitting in the wind.
Well, you
I-
probably shouldn't have said it.
I will keep spitting into the wind
Well,
instead of choosing to euthanize a cat any day of the week.
But it's not solving the problem.
It's worth it to me to not kill a cat, and it's worth it to me to try and do something other than turn
Okay.
around and not face the problem at all.
I think you can take that statistic and make it specific. So I think the key to being successful is to concentrate that spay and neuter on specific colonies, which is a lot of what Visalia Feral Cat Coalition advocates for as well. So if you take an area and you spay and neuter 75%, then you're going to potentially achieve success in that area. And as he said, cats are territorial. So the goal would be to concentrate efforts in colony after colony instead of like peppering out your services. So that is what we aim to prove with San Francisco SPCA and the city of Early Mart, is to see if we can achieve that 75% and see if it makes a difference on cats and dogs.
So, but
you
with
have
the-
to concentrate that effort into those populations.
I understand that, but you talk trap, neuter, return.
Correct.
So that means if a person wants to do the right thing, has a feral cat in his yard, gets it sterilized, he's got to live with that from then on. He has that cat because you've got that vacuum effect.
Correct.
So you're damned if you do and damned if you don't.
Well, you're going to coexist with something. That
Well,
space is there.
But the other thing is, feral cats, the diseases they carry in their feces. I've got a garden that's I can't use now. I'm going to have to clean it up, and then I'm going to have to fence it just to keep a vegetable garden to keep the feral cats out. And they steal my cat's food and fight with my cat. And I love cats, but I'm between a rock and a hard place.
What is your suggestion or solution? Because we're hearing,
Oh.
I hear you. I have to.
Okay, the solution is the city needs a holding facility. When I see a feral cat and I know it's pregnant or it's mating, I want to catch that right away before it has a litter. I want to cut off that pipeline. So I call the city Tuesday morning, 8 o'clock sharp. I'm on hold for 10 to 20 minutes. No vacancies. So what do I do with that cat? I try next week, same thing. I've gone 3 or 4 months in a row and couldn't get an appointment. So in the meantime, how many litters has that cat had? I have one in my backyard now that's had the second litter there. The first litter, I adopted one. Now I've got 5 kittens that I've got to find a home for. What am I going to do? And you know what? I can't keep them because the city limits me to 4 cats. I already have 4 cats. So what am I going to do? The city won't help me to get rid of the cats, but I can't keep them. What kind of deal is that?
Well, I happen to know from personal experience this summer that the city gets sporadic funding for 20 to 25 cats in one program. And you've done that. That you don't have to call for. You just have to get there at 7 in the morning and stand in line.
And you have to be one of the first
20 or 25, depending upon the funding level.
Okay.
Yeah.
But in the meantime, these cats are getting pregnant and having
Yeah. Get the kittens fixed.
We need a holding facility. When I see the cat, I'll set the trap, I'll catch it, I'll turn it over to the city. The city can DNR it or euthanize it, which I know people are going to throw stones at me for saying it, but that is the only solution. TNR is not going to work until you get the numbers down. Oh, I'm sorry. TNR. I'm sorry. TNR is not going to be effective.
We understand your frustration. Let's see if we can get some answers, some hope for you, sir. Okay. This isn't hope. This isn't the hope part of it. But we haven't talked about euthanasia yet. Well, it's the city and I guess the county will be the only agencies here right now that are using that method of pet population control. What does it cost you? How many? And is it effective, I guess?
I don't actually know the rate. Jason Glick is here. He came in from his other meeting. He is the director of our Parks and Rec department, which includes animal care facility. Do you know our euthanasia rate? I don't know. Yeah, I don't. So I can tell you it is mostly large animals. We're much better with being able to either return, rescue, adopt, or foster the smaller animals. We have a very hard time with the larger animals.
Those would pretty much be all dogs, then, I guess.
Yeah,
right?
yeah, it is.
Yeah.
Well, unless we only accept cats that are sick, injured, or dying.
Okay, what are the conditions for euthanasia?
So
Sick, injured, or dying cats, and
well, sick, injured, or dying animals.
Animals.
If it is just one that cannot be, then that one would be immediately euthanized. In Visalia, cast your stones, folks. It is if the animal comes in with no identification and we have no idea where it is, then it has to be held at least 4 days. If it has identification and we're trying to find the owner, it will be 7 days. We try to hold all animals for 7 days if we can. And after that point in time, all 4 cities, it is the animals euthanized. If we can't find a return, a rescue, a foster, adopt, or a foster.
Can I ask you a question?
Sure.
You have a pretty large facility. What's your occupancy rate?
I don't know that off the top of my head.
Yes.
how
Yes,
many do they hold?
we are usually, especially right now, we are usually full. But it depends how many small animals do we have versus how many big, because we can put.
So you have no empty kennels on a daily basis?
We do have to. Sometimes we may have some because we do have to hold some for the contract animals that we have. So I'm not going to tell you we never have any, but we are oftentimes. And again, it depends on the time of year. It depends on many circumstances.
Okay, thank you.
So Leslie, are you saying if an animal comes in with a tag on it, you will only hold it for 7 days before euthanasia?
Well, if it comes in with the tag, we're certainly trying to find. First, we're going to try and return it that day to that. We hope never to bring it into the shelter because as soon as it comes in, it's exposed to more things.
Because someone could be on vacation.
They could be. They could be. I asked that question. We don't find that often. Usually some cell phone number, we can usually find a neighbor, we can usually find somebody in that type of situation. I'm not going to tell you it never happens, but that does not seem to be a prevalent problem. Out of everything else that we have trouble with in trying to get those animals saved, that's not the biggest issue.
Okay, fair enough.
My turn?
Yeah.
So we do things a little bit differently. As I said before, we have 65 kennels and we have anywhere between 20 and 65 dogs coming in per day. So I'm not going to tell you that we don't euthanize because we do, and I'm very open about that. But we do what we call pathway planning. So if an animal comes in that we know can go to rescue, like say it's a German Short-haired Pointer and we have a good relationship with German Short-haired Pointer Rescue, we are going to contact that rescue the day that dog comes in so that by the end of the stray hold, which legally by state law is 72 hours, we hold animals for 4 days. So we don't count the day that they come in, 3 days after that, and then they're available for adoption or rescue on that day 5. We also send animals to rescue as foster to rescue. So we will send animals to BJ, who is local, and with the caveat that if the owner shows up, which isn't very often, that BJ, we come and get the animal back and we return it to their owner. But that frees up space in our kennel. So the goal is to get the low-hanging fruit dogs, the dogs that are going to be easy to get out as fast as possible to save as much space for those who might take a little bit longer. The pathway planning also does include the other end of that. So if a dog comes in with a severe bite history, we are probably going to euthanize that dog at the very end of the stray hold, which is on that day 5, because that leaves an open kennel for an animal that might be harder to place but nice to stay a little bit longer. When we're talking about making selection, that selection is ultimately signed off by me, but is made by multiple people. So myself, my shelter manager, or my shelter supervisor, and our rescue coordinator. We have one coordinator which is more than City of Visalia has. So we do at least have that going for us, is that we have a coordinator, but she runs our foster, adoption, volunteer, rescue, and outreach programs by herself. So between her, me, and the shelter supervisor, we make educated decisions, what we believe, on the dogs in our care, because it's mostly dogs that are being euthanized for space. We don't euthanize cats for space. We only euthanize cats for severe medical. We treat medical conditions that we can, so we remove legs all the time. We remove eyeballs all the time. We treat skin infections. We treat upper respiratory infections. We take out eyeballs. We do all of that and still place that animal for rescue or adoption. Don't charge anybody anymore. We don't charge rescues to pull animals. But we do pathway planning so that I can know at the end of the day, I can sleep at night and think I have tried my best for each animal that is in my care. And at the end of the day, either we had to euthanize because we didn't have the resources, the dog is suffering from severe kennel stress, or it has a medical condition, or it is behavior. It is most of the time behavior that causes that selection, and either that is behavior that is unacceptable toward people, it has bite history, it is lunging at the front of the kennel, or it does not pass dog testing, which means that honestly, no rescue or adopter is going to take it unless it's a doodle, if it doesn't like other dogs. Or it is severely injured or sick. We have horrific medical cases coming in all day long. Sometimes it feels like an ER at our shelter because the vet techs are just consistently triaging horrific and very traumatic cases of injury and illness.
Really piqued my curiosity about what's horrific.
Okay, so the other day I had to figure out how to euthanize a dog that was so covered in maggots that I could not figure out where to find a vein.
That's horrific. Okay.
I'm sorry. Let me just tell you that when the Starbucks barista asks me what I do, I'm hesitant to tell them because all I get is these flashbacks of horrible things, and I could tell you stories that you don't want to hear about things that my staff witnesses on a daily basis, but yet still keeps coming to work.
But never mind.
We could meet for coffee later. I will tell you all my horrific stories.
Could you maybe talk a little bit about the phases of different types of animals that goes through? Like one of the things that our animal care facility manager said is that right now the big trend is English bulldogs.
And Frenchies.
Mm-hmm. Right, and I was like, wait, what?
We have 4 Frenchies at the shelter right now.
Yeah, because they were popular. They were in. During COVID, it was Huskies.
Yeah,
Who brings a Husky into the valley?
Oh, yes,
where
during
we've
Game
got
of
this
Thrones.
kind of heat and a very, and there, it's just sometimes making the right decision about the type of animal that you're going to choose to have in your home.
Remember the Jack Russell Terrier phase a few years ago because of Fraser?
Dalmatians, Dobermans.
Yeah, Dalmatians. I just mentioned that too. Yeah.
We have a lot of Dobermans that come through the shelter. We had a rash of Dobermans, and everything right now is a German Shepherd.
Yeah. Everything's a German.
Yeah, a ton of German Shepherd, and every puppy is a German Shepherd mix. We have so many large breed puppies. At one point, we had 120 dogs in the shelter, and 90 of them, or 95 of them, were puppies under the age of 4 months. So when that happens, we do a lot of adoption specials. So our adoption fee that's set by the fee schedule is $100. We almost never charge that because we have a sliding scale. So if the animal has been there for more than 5 days, it goes down to 50. After 14 days, it goes down to 25. And after 29 days, it goes to 0, and we do a fee-waived adoption to try to get that animal a live outcome. We have some dogs that are there for 2 months and can survive and are okay and don't get kennel stressed and aren't suffering from kennel stress because sometimes that is a euthanasia criteria. The dog has just deteriorated so much in the kennel that it's suffering.
Just can't live in captivity anymore. Yeah.
Right. But for the most part, we are making decisions based on behavior. As far as reclaims, we tried to get animals out in any way possible. So if somebody comes and they're interested in getting their dog back, as long as they don't have any outstanding violations or issues or there's a cruelty problem, we will not charge them fees, or we will charge them whatever they can afford. That's the conversation we have. Well, what can you afford? And we have grants that cover that. We don't just waive those. Supervisor Shucklian. We cover them. with grants and donations that we take in through Friends of Tulare County. So we cover all of those costs. Same with rescues. Even if we do like a leg amputation, sometimes that's what it takes to get the dog out, is we have to take off the leg, and because rescues can't afford it. And then I call BJ, and BJ comes and gets the dog. But no, we do. We don't charge rescues for the extra things that we do. I have a wonderful part-time veterinarian that comes in and does all those lovely things for me, who is an amazing surgeon. So we are really, really fortunate in that we can provide a lot of that care to the animals in our shelter that some other shelters don't have that ability to provide. We have x-ray capacity, we have lab work, we have our clinic, we have a surgery center. So that is an advantage that we have for sure.
Can I ask, do you charge, and this question is to all of you, do you charge a fee for someone to surrender an animal to you?
That's a good question. There is a fee to surrender an animal to us. We take owner surrenders on a case-by-case basis. So if somebody needs to surrender their animal, we have a packet on our website, or they can pick one up in person, and we take that on a case-by-case basis. So a lot of the owner surrenders that we take in are from the field. So the officer goes out and they find this family who is struggling and has 15 German Shepherds. So what we will do in that case is we will case manage that property. We will work with the owner to begin taking animals from their care, but at a rate that makes sense to not cause mass euthanasia in our shelter. Because if we take in all of them at once, then we're going to have to euthanize 15 dogs to bring them in. So usually what we will do is assign one kennel to that property. We have a number of these happening at any point in time. And then that owner can bring in and surrender the animals, usually fee waived in those cases, to us a little bit at a time, because at that point it's a nuisance call at the same time, because their dogs, we usually get called because the dogs are running loose. That way they can come in a little bit at a time, and at the same time we are working to spay at least the females that are on that property that they plan to keep. So you can have up to 4 dogs unless you have a non-commercial kennel permit, and then you can have 5 or more. $75. I'm sorry. And all of our fees are posted on both the county's website and the master fee schedule, and on our website there's a link to them as well. So they're all public knowledge.
Where is your shelter if somebody would want to come out and maybe adopt a dog?
We are in the middle of nowhere. No, we are off of Avenue 256 and Road 140. So if you take Lover's Lane out past the edge of town and just keep going until you think you're going to end up in nowhere land, and then turn left. That's where we are, by the road yard.
We're on the other side of nowhere. She's on the east, we're on the west. We're on the west side of the airport. I cannot recite the address off the top of my head, but if you go to Animal Services, we are out there. I would tell you that I was at the city when they chose. I think that was a mistake when we decided to leave the animal care facility out there. I think we'd be better off, and I think we'd probably have a higher recovery rate if we were a little more centrally located. We have a beautiful facility, but no, I know, Amy, you and I both, lots of discussion.
When they used to build animal shelters, they purposefully put them out by like public works and things out in the middle of nowhere, I think, just to keep them out of the way, and it's just hard to get away from that.
Yep. And that's where the cheap land is to do something like that, so that's what you're fighting.
I was wondering, a couple of years ago, I was trying to place a Chiweenie, and I remember calling around and people said that they were very difficult. There was an overabundance of Chihuahuas, and not even to bother to take it to a shelter because there weren't enough people to adopt them. Is that still the case?
With a small breed dog, unless it's trying to bite your face off, we can usually find rescue or adoption, but it is difficult for us to have open space for owner surrenders at this time. But strays that come in, as long as they are relatively friendly, if they're, say, under 30 pounds, we can usually find rescue or an adopter for them.
Do you have an overabundance of Chihuahuas?
We have more German Shepherds. There's always going to be, I think, an overabundance of small breed, short-haired dogs, but definitely German Shepherds.
Okay, what about, BJ, do you have something to add to that? You
Well,
kind of picked up your microphone pretty.
Yeah, I don't have anything to add to the euthanasia piece, but if we're talking about outcomes, I would like to put things into perspective. I have been doing this in this same location for 24 years, and I will tell you that the adoption pool is much different than it was. Okay, yes, COVID a little bit, but the financial situation is different. You know, if kids grow up and never move out of home. You don't have new homeowners. You don't have a new family that's starting out with their picket fence and their Cocker Spaniel. Things don't look like they used to. So people are changing their attitudes towards pet ownership. Pet ownership requires a high level of responsibility, and we're not necessarily seeing that so much.
Really?
We have,
I'd like to explore that a little bit more. Changing their attitudes toward pet ownership?
well, sure. We take a lot of owner surrenders. Our goal is to try to keep the dogs out of the shelters as much as possible, and if we can help by taking owner surrenders. But surrendering your dog because it sheds, or because we're having a baby, which you knew when you adopted that dog, or, the list is unbelievably long. Instead of finding a reason to make that animal a part of the family and to fit in and learning about things that you can do, it's a whole different.
That's just not happening anymore, huh?
Not very
Not
much.
as much.
We have not placed a large dog, which I consider basically over 50 pounds, in 3 months. 3 months.
I did want to get to adoption of animals and placing them in homes or on a track to get to a home anyway. So you've started that discussion.
Sorry, jumped in.
Well, no, I appreciate it because that's where I was going to go too. How about how much does it cost?
Well, a lot less than it used to. It
Microphone.
amazes me that.
Microphone.
Oh, I'm sorry. So we constantly hear, well, why do you charge so much? We have not raised our adoption fees in 8 years. Our average adoption starts at $150 and goes down because we constantly reduce fees, just sort of like a sliding scale, as Cassie was talking about. Once they've been there for a while, we start to reduce fees just to try to get them into a home, because there's no benefit to being in an institutionalized setting for them or for us. So
What do you get for your 150?
way more than you should, probably.
I'm sure,
You get the animals have been cared for quite some time. They are spayed, neutered, microchipped, current on all their vaccines. Most of them had flea treatments, deworming treatments, and we even have part of our staff right now is a trainer. So we get the benefit of being able to socialize and work with some of the dogs.
That's the basic
Way beyond basic.
home training.
Yeah. Yeah.
VJ, I had a question about where does the railroad take the animals? A couple years ago, I was hearing like LA they took all the Tulare County animals.
Yeah,
I know it might have changed.
The trend over the past 10 years was to rescue our way or transport our way out of this crisis. It's not going to happen.
So where are you taking us?
So we are just now probably ending our longest term partnership of 20 plus years, because in San Diego, and that was our puppy partner, but they're going and getting dogs from Oklahoma and other places and doing different things. So for us to try to find, that was the basis of our rescue. That's why it's called the Rescue Railroad, is that we were taking dogs out of shelters, caring for them, and moving them into other areas. But those other areas are also now saturated, and they're struggling in the same way. So trying to find these partners that will help us in large numbers. We don't load the bus up a whole lot anymore. So we're depending on, the
DJ,
local.
remember to use that mic, would you?
Sorry.
Thanks.
Yeah, there you go.
What's the cost for other agencies for adoption?
155 for a male, 165 for a
Same
female.
kind of deal. Okay.
Our dog adoption fee is $100. Cat is $70, but like I mentioned before, it depends on how long the animal's been there. So after 5 days, on day 6, it goes down to $50, and then day 14, it goes down to $25, and then after 30 days, it is a fee-waived adoption that we're covering through grants and donations.
Sounds like Filene's basement.
Yeah,
Wait
and
till it goes down
there
to
is
day
always
4,
the
you get a cheap
concern
deal.
that we get. There's always the concern that we get that people are like, well, they're not going to care for a free animal. But in reality, we really haven't seen any difference when we're running fee-waived adoptions as far as our return rate, and we will always take back our adopted animals. So when people adopt an animal from us, they know that if it doesn't work out for some reason, they can always bring it back. Those are owner surrenders that we will always take. So I think that it doesn't make that much of a difference as far as the quality of care. I think it just depends on where they're going. And unfortunately, I think that we're probably stealing some of BJ's adoption.
How hard is it these days
To adopt an animal?
to get your animals adopted, to find adoptive families?
You know, it always surprises me what dogs people pick, because the dogs will, we do foster to adopt, so I think that that's twofold. One, it clears our shelter faster, and two, it allows the family to make sure that it's a good fit, and then they generally bring them back in a few days for spay and neuter. We have a really great success rate as far as people don't just not show up generally. And if they do, we send an officer to go get the animal back.
Foster to adopt
And
means
repo?
that the animal is in the home for a certain amount of time.
Correct. So it means that the animal goes home as a foster animal, which stays so that the ownership of that animal stays with the county until they finalize the adoption, which is when the animal is spayed or neutered.
Okay.
The other good option for that during that time, or the other good reason for that during that time, is when somebody does foster to adopt for a puppy, we will continue to provide those vaccines every 2 weeks until the spay and neuter happens, so we can make sure that puppies have more than just one vaccination. Litters of puppies do not have a stray hold, so we put them up for adoption immediately, and that's foster to adoption. So then they can go out to homes, they can be not in the shelter, they can be in a home, but they can continue to get those vaccines every 2 weeks until the time for their spay and neuter. They get spayed and neutered, and then the adoption is
Okay.
finalized.
Yeah, good.
We do conversation-based adoptions, so we have an adoption application, we use it for basic information, but we have conversations with people. So my staff is talking to people to try to find the right fit for them, which I think plays a part in whether or not the adoption works out.
Yeah, good. Anything else about adoptions from any of you? No?
We do have a question.
Yeah, go ahead.
Oh, hi, everybody. I have a lot to say. I tried not to jump in here and there, but just kind of covering everything that we talked about. Is there, like, speaking of adoptions, before we go on to another topic, what about, like, senior programs? Like getting dogs and cats into senior households? Is there some kind of, I mean, it seems like a great idea. You got seniors at home might need a companion. If there's some kind of program to push for some of that where they can be put, and this is all the agencies.
We would
pushing
love
for-
that. And actually, that sounds like a really good foster program, too.
Yeah.
Seniors that are fostering, especially senior animals. That sounds like a great plan. I'll
Yeah.
talk to Jessica about that.
Yeah, awesome.
We have a what we call our Grandpaws program, which is senior dogs, hopefully looking for senior homes, and a little special place where some of them are able to be housed on site.
Yeah. Yeah. it seems like a
Veterans are
win-win.
always fee-waived adoptions. That's a California state law.
Okay, yeah, good, because it's a win-win. Veterans for veterans.
Okay.
Okay, okay, I still have more to say.
We're not getting the benefit of your.
Okay, I get really excited about that because I've worked with another organization in Martinez, California. A lady up there has a cat. Well, she can't use the term cat lounge because there's a place in Los Angeles that won't let her do that. But basically, she calls it the cat lounge. She only takes senior cats, 7 years and older, and she partners with the Meals on Wheels program up there. If the senior adopts the cat, then the Meals on Wheels takes them the food.
The cat food?
Yes.
Wow.
So, Meals on Wheels is a county program. It's I don't know how you can mesh that all together, but it works for the senior. It works for the animal.
That's an interesting thing. We do partner with Human Services on providing, when we provide dog food or we come into contact with somebody in the field that needs pet food, we generally will provide it, but we also provide them information on CalFresh for human food. So we partner with Human Services on that. That's an interesting prospect for senior adoptions. Because sometimes it's an income related issue.
Even at senior home facilities where they might benefit from petting a cat, and it's good. It's a win-win for everybody. Okay, moving on. Leslie, you mentioned earlier about education. Pushing, because it seems like getting ahead of this is really about the spay and neuter, and I think we all kind of know that, right? We want to, if we get ahead of the spay and neuter as much as possible. Some of it, we know that there aren't always appointments available. But what about education to the public? Because I feel like that's part of it. I think there are those of us who know that we need to spay and neuter our animals, and I think for some people out there, it's just not a priority. whether it's lack of education or it's a cultural thing, whatever it is. So I'm wondering what more can be done for education in the community, what's already being done and what can still be done. You know, I work for VUSD, and I constantly think that is a huge sort of captive audience. You know, I think back to Nancy Reagan, and when you push for something, an idea, and you make it well known, like just say no. We all know, if you're from the 80s, right, you all know just say no. We all know what that is. And we heard it everywhere, and it was everywhere. So I feel like in Visalia, what are some of the number one problems we have? And I think many of us would agree this is definitely a number one issue for many people. It's not the only issue, but what can we do to sort of get out there? I mean, put posters on the sides of buses, go to the schools, partner with the USD, get kids to understand. When you get the kids on board, they take it home to the parents. And I think if we prioritize that as a community, that's a captive audience. You know, you're sending flyers home on the importance. Oh, do you have a dog or a cat at home? Great, great. Is it fixed? Can you get it fixed? Let's get it fixed. That's just what you do. It's part of pet ownership. So it seems like the VUSD is a great source to be able to partner. Visalia Unified School District, the schools, right? Go to the schools because you get kids want to take care of their animals.
Do you go into the schools?
We have in the past. Like I mentioned before, we have one coordinator that does all of those programs, so it's a little hard to find the time in a 40-hour work week, or actually hers is probably more like a 50 or 60-hour work week. But we have done that in the past, and I think it is very important, especially in our rural schools where we have such population issues in some of our rural communities.
Yeah, absolutely.
But I think some of the fear too, I think with shelters is what happens when we get that education out there, which is highly needed, and we're already getting flooded with calls and have to tell people we don't have resources for you. So they're trying to figure out how to address the capacity for care issue first so that then we can open the floodgates. We can't even begin to provide the amount of services that are being begged for by our community. We would need 10 more clinics, which is phenomenal. People want to spay and neuter, but they just can't access it or can't afford to do it at a primary care veterinarian.
No, get
No,
the
you can't.
microphone just like everybody else. But I do want to talk about Shelter Buddies, which is actually a program for with Pro Youth. And they bring, I think it's third graders out, and they come and they read to the animals at the care facility. And it is adorable to watch. It is great to watch the animal just bond with that child right there. And the other thing that I know we've talked about, I don't know if we got it done this year though, is doing a summer camp around pet care. And going out to to be with the animals. At times you got to be careful because there's lots of issues with that. But just to teach animal care, and especially kids, like you said, are very interested. It is harder to get into schools these days. I know we all think that's a great idea, but they are so driven by state law and so on that introducing a new unit is very difficult. And I don't blame the teachers for that or the school. It is just where we are as a society right now. I hope that changes. But there are things that we're certainly looking at. But just like Cassie said, you hate
one over there. Okay.
to have people want more services you can't provide.
Hi, my situation is a little different. I'm not a foster of cats. I recently moved into an apartment. I'm retired, don't have a big income. I have 2 huge ragdoll cats of my own. And when I moved in, I found a feral colony in the back. And the landlady was aware of it, and she was really sweet. She said, if you'll help me, I'll give you the cat trap, because she knew I wasn't working. And so, yeah, I did that, and then she reimbursed me, which was great. But now I'm stuck feeding the cats, which I can't afford. One is sick, and I don't know what to do with it. So do you have any advice on how I can go from here? And I did find homes for 2 of them.
Where are you?
I'm here in Visalia.
If it's a sick cat, I'm assuming that Animal Services would take it because technically it's not yours.
And I have a number I can share with you for that,
Okay,
for the
but
sick cat.
But would you take care of it? Would you get it well? I mean, what would happen to it? I'm really close to these cats now, so I'm just curious.
I think a lot of times it depends on how handleable the cat is and what kind of illness it is. So if a cat comes in to our facility, at least, which I assume it would be similar with the city of Visalia because we share a contracted vet, if it is able to be cared for safely by staff and is handleable enough, most of the time, I mean, we will treat basic illnesses. If it has 2 broken back legs and is feral, then that's
I-
a euthanasia case.
The majority of them, I can handle them. I've even spayed and neutered 2 adults, not 3 adults actually, 2 mothers and 1 stud. I wasn't going to help the landlady at first, but the kittens were all over the carport.
You know, I think if a conversation with Leslie Cavilla is really going to serve you.
I'd appreciate it.
I'd like to jump in here real
quick.
I'd like to jump in here real quick. A lot of the vets that do the TNR work will do follow-ups if you reach out to them. If you have access to the vet that did the TNR and you let them know that you're still working with them, a lot of them will be able to work with you either on discounted care or even advice. Another thing I'd like to recommend is there is we have our information on our website, and we have a huge network throughout Tulare County and beyond on our Facebook, where a lot of people who share similar experiences as you will be able to, you'll be able to open up that conversation with them, and someone who has dealt with something you are dealing with, you might be able to connect and find the answer you're looking for. Of course.
What is stopping a procedure to create specialists to perform this surgery? You're mentioning 5 or 6 minutes. It seems like you could have specialists that could do this in mass, and I mean,
They
to
can't.
get the
They
job
aren't
done.
licensed. The state won't allow them to be licensed.
Get licenses for this serious
just
problem.
came in late, Gene, because we did talk about that. We
Yeah,
tried
yeah.
for over a decade to get that law passed. That would allow some sort
You've
of.
thought
that
of it.
type-
I appreciate
yeah. No, and we believe there's going to be legislation again next year.
They're also working on an injectable sterilization drug, which is, I think, at the FDA level at this point, but will probably take another several years to get through. Right now, they've done studies just on cats, mass injections on cats. So they are testing it. The last I heard, they were testing it in Canada in feral cat populations, but they did a long-range, several-year-long study that has shown that this injection will cause lifetime sterilization in a female cat. So the thought would be then to expand that to dogs. So there's a tiny little sliver of a light at the end of the tunnel.
Oh, come on, there's got to be more than that. Supervisor Shuckleyan, do you mind if I pick on you? Yeah, I know you are, and usually I'm the one who's doing the picking. I'd like to ask you a question. You've been at this for a long time, well, a while. Give us some hope. Tell us that things have improved in animal services, in our approach to care, in our institution's approach to dealing with the pet population.
That I can tell you, yes, in the care, I think just with Cassie talking about what the board is putting into the shelter,
Yeah.
budget, there's an additional $3 million for improvements. The support of the spay and neuter clinic, we know that's a big deal throughout the county, not just in the unincorporated areas of the county. Does that help?
Yes, it does.
You know,
And
the other issues, the overpopulation and all
yeah, you
that,
should probably get back there.
it's tough. I rarely need a microphone. But again, it's tough.
Yeah. That we have learned that there's a lot of obstacles. Economic,
But
political.
I'm very glad that we have Cassie.
Okay, good.
Thank you. Right.
Yeah,
right,
that's
the
for our
money is
county
for the county
county
shelter.
facility. But the city, I mean, if you haven't gone out there, it's a beautiful facility. I don't know who was on the council when it was built or supported it, but I mean that in itself, to see a facility and the care that you put into the facility, I think says a lot about a community and how they care about their animals, or the local government and how they care about their animals. It's just overwhelming.
Last word to anybody on the panel here.
If anybody'd like to sign up to foster, we'd love to have you be a foster pet animal. And please, I'm sure Cassie the same, that there are ways you can help, even if it's just for a short term.
I left a whole bunch of flyers in the back about how to foster. We also have an Adventure Pause program where you can come give a dog a break from the shelter. So you can sign up using the QR code, or you can call to sign up for a time to come and take a shelter dog out for a hike to the park, to your house. There's some rules, but give the shelter dog a break. Also get great pictures of them, and we get more information as to what kind of dog they are and how they behave outside of the shelter so that we can help get them homes. So there's information on all of that in the back, and you're always welcome to email me with any questions. I can leave my business cards back there as well.
And I will reiterate that all of these agencies have websites with a lot of information on them. A lot of information, whatever your issue is or whatever you hope to do. Even when it's just get in there and foster or volunteer, that information is a keystroke away. So try it. Yeah, I know. I know, but he's. It is 8:34, and we need to conclude at 8:30 because that's all we've got allowed from our landlords here. So I want to thank you all for coming. I appreciate all the input from all of you. If we didn't get to you for your question, I apologize. But before we go, would you give the panel here a round of applause for their... Mark, Leslie, BJ, Cassie, thank you very much. Did an excellent job.
Thank you for hosting us, and thank you everyone for showing up. The hope you guys are asking for is in the community. We can't do this without the community, so thank you all for being here.
We'll be back next month, October, I think it's 14, and we're going to talk about how changes in immigration policy are affecting our community. We hope you will join us. Good night. Second Tuesday of October. I think it's the 14th. I'm not sure, but okay. Thanks. Good night.
Okay, no emergencies that anybody's reported yet.